Okay, so moving on to section 2 of chapter 8, we're going to talk about one of our types of structural classifications, which is our fibrous joints. Anytime we're talking about fibrous joints, that means they're not going to have a joint cavity, because remember, only synovial joints have a joint cavity. These are going to be joined by collagen fibers, so that's the material present that's actually connecting the two bones together. And most of these joints are going to be immovable, meaning that they're synarthrotic. Really, though, it's going to be dependent on the length of the connective tissue fibers or the collagen fibers that are connecting the bones, is going to determine how movable they are. So they'll either be immovable, synarthrotic, or slightly movable if they're a little bit longer in length, or amphiarthrotic. We have 3 types of fibrous joints. We have sutures, syndesmoses, and gomphoses. So the first one we're going to talk about are sutures. These basically are seams, and they're only found between the bones of our skull. So if you think about your parietal bone, your occipital bone, your frontal bone, and your temporal bone, they're all connected by sutures. And you actually had to name the specific names of these sutures in lab. However, you probably didn't realize that these sutures that are connecting these different bones are actually joints. So the collagen fibers connecting them are really, really short. And as you would expect, they're not movable. We do not want the bones within our skull to move. So these types of joints are synarthrotic. So really the thing I want you to focus on here, when you go into your 3 types of fibrous joints and your 2 types of cartilaginous joints, is basically whether or not they're movable. So in this case, they're not movable, they're synarthrotic. And a good example of where you can find this type of joint. And the example that you should be focused on for these specific types of joints is the one presented to you in the picture. So this is found only in the skull. Our second type of joint is syndesmoses. And these are going to be the bones that are connected by ligaments or bands of fibrous tissue. That's basically what a ligament is. However, its movement is going to vary depending on how long the fibers that are connecting the bones are. So if we're talking about the fiber or the ligament that's connecting our tibia and our fibula, this is going to be a much shorter fiber. So it's going to be a synarthrotic type of joint, so immovable type of joint. If we're talking about the ligament that's connecting our radius and our ulna, that's going to be a little bit longer of a fiber, so it is going to allow for some movement, and therefore it's going to be an amphiarthrotic type of joint. Our third type of joint that's fibrous is gomphoses. It's a peg and socket type of joint. The only example we have in the human body of this type of joint is our tooth and our alveolar socket. And the ligament that's connecting the tooth to the socket actually has a specific name, and that's your periodontal ligament. And if you think about your teeth in your mouth attached to their alveolar socket, you would expect that we do not want these to be movable joints. So gomphoses joints are not movable, and therefore they're synarthrotic.